It's time for us to link up with the Arise London studio to talk to Mrs. Toyin Saraki, the founder and Chief Executive Officer, Wellbeing Africa Foundation. Welcome to the program. Good morning. Thank you for joining us this morning.
Good morning, Layla. Good morning, Tudu. It's lovely to join you.
Thank you for being here. So let's start off with the Wellbeing for Africa Foundation and what it's all about, ma'am.
You know, the Wellbeing Foundation was established in 2004, largely because I wanted to stop preventable maternal deaths. I had a personal experience having a child in Nigeria in 1991, and I probably was the typical Nigerian. I was giving birth in a facility where I had not had my antenatal, so that facility really was not expecting the set of challenges that presented in front of them. They were very, very good. This First Consultants Medical Center in Lagos. They managed to save my life. They managed to save the life of one of my children, but one child died. And after that, I really began a fairly informal quest for knowledge and to be able to apply that learning. When my husband then became a governor, you know, it's traditional for First Ladies to set up a pet project to try to complement the government's effort. And originally I started specifically for Kwara, the Kwara Wellbeing Trust, which undertook interventions. But right from the beginning, I also had the parallel organization, the Wellbeing Foundation Africa, which I wanted to take a more national and regional approach to the challenges that we found. I think from about 2006, I was gravitating towards the Federal Ministry of Health because I was noticing a set of statistics that initially I thought it was an aberration and I thought I was the only person who could see it. But when we started gathering data, we realized at that time that 1 in 6 Nigerian women was dying in childbirth. And it was very clear to me that I would have to intensify the learning, intensify the knowledge, reach out to have strategic partnerships that were going to be guided actually by a set of guiding principles. And my aims are very, very simple. Every pregnant woman should receive the right care at the right time. Every newborn should receive essential care straight after birth. Small and sick babies should be well cared for in a facility. All women and newborns must receive care that actually prevents hospital-acquired infections. Health facilities must have the appropriate physical environment, and we need to communicate with women and their families to be very effective in a way that respects them the way they understand. Women and newborns who need referrals should actually get these referrals without any delay. And no woman should be subjected to harmful practices or disrespect during labor, childbirth, and the early postnatal period. Health facilities also need well-trained and motivated staff who are consistently available to provide care. And finally, but this is where we actually started, every woman and every child should have a properly completed and accurate health record. Now, over the years, this has led us to have many, many partnerships, local partnerships, regional partnerships, global partnerships. But I think we're seeing some results that when I started this work in 2004, 1 in 6 Nigerian women died in childbirth. Today, in 2020, I believe the figure is something like 1 in 13. Now, 1 in 13 is still far too much, because when you look at a country like Finland, you have 1 in 40,000, but we're getting there.
We will get there. Thank you very much. You've really been doing amazing work. And it must be said that from 1 in 6 to 1 in 13 is a huge leap. Yes. Now, you've raised so many issues. I want to start with your personal experience of giving birth in a hospital where you did not have your antenatal care and how that has led to the mama care part of your foundation's activities, whereby you've had hundreds of thousands of women going through antenatal care, and you haven't lost a single mother. That is a huge accomplishment, so congratulations on that. And I want you to take us through the mama care activities that you do and other activities that form your foundation's work.
You know, I originally started the mama care program in 2015 because I realized that after a decade of advocacy, working with health workers, working with doctors, there was still something missing. And I felt that what saved me during my experience was the fact that, not just because I was educated academically, but I had acquired the knowledge that would make me an equal partner with my healthcare provider. So for instance, when they said you need 3 steroid injections, I knew exactly what they meant. There wasn't any further delay. I was a willing partner to get a better outcome. And I was still trying to figure out what is going to make the difference. You know, we have a land mass in Nigeria of 923,763 square kilometers. And here I am deciding I have this ambition to, you know, keep every pregnant Nigerian woman alive. But I couldn't reach them. And it was a chance meeting. I was in New York. I met a lady called Frances Day Stirk. She was the president of the International Confederation of Midwives. And all these years, you know, for 10 years, I've been working with doctors. And all of a sudden, I thought, hang on a minute. The midwife is actually the one with the mother throughout her labor. She's with the mother even from the time she gets pregnant. So if I can work with the midwives, I can reach more mothers. My Mama Care program is a midwifery-led antenatal and postnatal care and counsel program. And it's unbelievable. I started it with 3 midwives. 1 in each state, 1 in Lagos State, 1 in Abuja, and 1 in Kwara. And the results just stunned me, because I went from being an advocate who was trying to work with government to enhance policy, to change the way people worked, to actually having direct contact with over 8,000 women every week through the midwives who are my interlocutors. And they are just practicing their profession, but they're practicing their profession in an equipped manner, in a reasonably remunerated manner, and they are reaching the mothers directly. Now, the first thing that we saw was that in the hospitals where we were giving our Mama Care classes, and I believe now today we have Mama Care classes running in about 573 hospitals, both public and private, around Nigeria, we noticed an immediate upsurge in the number of mothers attending the hospital. They were attending the hospital because they wanted to come for the class. So the hospitals were very happy to have us teaching. We don't charge the hospitals for the lessons that we give in the hospitals. And the lessons are literally given in the hospital waiting room. So the mums come for their antenatal and they get a class while they're waiting for their antenatal. It provides a safe space to push the learning through and also to hear back from the mums. What is happening at home? What is happening with their pregnancy? What about the rest of the family? How are they feeling? Do they now have the education to eat properly? The first thing we saw was that, you know, in Nigeria, we operate a policy called focused antenatal care. That's a government policy that says that mums should come to hospital 4 times during the pregnancy. But the Mama Care moms, because they're coming for their lessons, they are coming to the hospital 8 times during the pregnancy and the postnatal period. And we discovered, having reached 230,000 mothers, none of our mothers has died. Not one single Mama Care mom has died during delivery or even in the postpartum period. Now, you could wonder why this is. I personally believe it's because they have a better bond with their health caregiver. They are educated in hygiene, in how to keep clean, in what are the danger signals. They are really an empowered partner in achieving a better health outcome. And, you know, I'd like to think it's probably Nigeria's first health visitor service, because after you deliver, the Mama Care midwife will also go to your house to check that you're breastfeeding properly, that everything is as it should be, teach you. It's almost a bit like our Mugwa system, teach you how to bath for your baby properly. You would have had those lessons during the pregnancy, but we also make sure that all is well at home. And if you were to look at the links between government, we started Mama Care in 2015. I think it was late 2018, I saw a new government program starting called the CHIPS, the Community Health Influencers and Promoters, and I thought, okay, you know, somewhere this is being replicated, possibly in a different way, but every step is a step towards development. You know, we call this the decade of delivery. I mean, the UN calls it the decade of action. I call it the decade of delivery because we've spent 10 years moving around the world, moving around Nigeria, seeing what works, and this is now the time to push it in. If you were to ask me what is the reason why this has survived, I would say the Wellbeing Foundation has survived and thrived because of our adoption of midwives front, center, and the heart of the foundation. This year is the year of the nurse and midwife, and even that is a victory in itself. You know, in 2014, I became the Global Goodwill Ambassador for the International Confederation of Midwives. We represent over 600 midwifery associations, over 1 million midwives in over 134 countries. And midwives have been working almost invisibly in between women during their pregnancy throughout. Everybody remembers the name of their doctor, but very few people remember the name of their midwife. And so I count it as a personal victory, actually, that both the WHO and the House of Lords in England and the UN have actually declared 2020 as the year of the nurse and midwife. Throughout the year, I hope to be able to unite to celebrate and demonstrate the competencies of midwives so that they take their rightful place in the health profession.
Absolutely. Thank you so much for that analysis, Mrs. Saraki. You gave some figures there that actually gave a lot of hope. I mean, the fact that you said that with 130,000 mothers that you've attended to, since 2015, none have died under this program where they're seeing or having attention with midwives on a double rate that they normally would. And that leads me to another question about your foundation, because I also know that you have an emergency obstetric and also newborn care in partnership with the Liverpool School of Tropical Medicine and also with Johnson & Johnson. So can we have some more details on this and how it works and how it can also be scaled up around Nigeria? But we are going to go on a very quick commercial break, and when we're back, the conversation continues. Do stay with us, ma'am. Welcome back to the morning show here on Arise News. Mrs. Toyin Saraki, the Chief Executive Officer and founder of the Wellbeing Africa Foundation, is still here with us in our studio in London, discussing the foundation, what it portends, and of course, projects that they are currently running. Thank you for staying with us on the program, ma'am. Before we went on a break, I had asked you a question with regards to your program, the Emergency Obstetric and Newborn Care Program, that I believe is also being modeled in Kwara State. So can we find out more information about this program and whether you plan on scaling it up across Nigeria and partnering maybe, of course, with private hospitals for this too?
You know, the EMONC program to me is an extremely exciting development. It's a program that we started in 2015. EMONC stands for the Emergency Management of Obstetric and Newborn Care. And it's actually quite strange how I found this. I was at a global meeting and I saw anatomical models. They looked like shop mannequins, but they also looked and felt like human beings. And we used these anatomical models to develop a particular set of training package that helps health workers respond to challenges, helps the mothers survive, and helps the babies breathe. Through the EMONC program, which actually is implemented by our partners, the Liverpool School of Tropical Medicine and Hygiene, and supported by the Johnson & Johnson Global Health, we can then train, I think we've trained over 600 master trainers and over 62,800 health workers to deal with preeclampsia and eclampsia, to deal with threatened preterm birth, to deal with normal and prolonged labor, to help babies breathe, to deal with bleeding after birth, and to provide essential care for every baby and essential care for premature babies. Since we started this program, and actually we're ending the Kwara State end of the program because we have actually trained health workers in every health facility in Kwara State in the last 4 years. I think we have already had a 15% reduction in maternal case fatality rate and a 38% reduction in the stillbirth rate. And it was particularly needed for Nigeria because culturally we no longer give up our cadavers for research. So the typical Nigerian midwifery student or medical student has never practiced on a human body until after they have qualified and graduated, and they're out in the field. So this was giving too much room for error. And the anatomical models are absolutely lifelike. In fact, if you were to deliver a baby on one of our anatomical models, you'd probably be stroking the model's hair afterwards. You feel the same sense of joy when the baby arrives safely. But this allows for an improvement in the quality of care. It's post-service training, so it actually takes place in the medical facilities where the health workers are working, and it helps them to refine their skills, to remove the margins of error that were causing the deaths, to improve the quality of the care that they're giving to the mothers. And having seen the success of the EMONC program throughout Kwara State, my next aim for that program actually is to take it to national scale. I would love to see every medical school in Nigeria and every school of midwifery actually have an EMONC skills anatomical lab. We've looked at the anatomical models, and beyond reproductive health, I'm even looking at models now that teach, emergency workers and first responders how to deal with road accidents, how to clear the airways, how to stop the bleeding. It really does allow for safer medical procedures, safer medical techniques, an improvement in the quality of care, and it ultimately saved lives. I have a doctor. I once went to one of our EMONC training fields, and there was a doctor who was 12 years post qualification experience. And he said to me after the EMONC, he's a very good doctor, he said, this is the first time I realized that I was doing an episiotomy wrong. And I said, what do you mean? And he said, before, if I needed to make the cut for the mother to be able to deliver the baby more safely, I just used to saw away. And now I know the correct technique where I put my fingertip over the scalpel and I make 3 little cuts and I can deliver the baby. I've seen midwives tell me that before, when they saw a mother presenting with breech, everybody used to run away because the baby was coming out feet first and they didn't want to be responsible for her death. So they used to take their lunch break so that she would die alone. Now they know the correct technique to pop the baby back up, loop their fingers through the baby's ankles and bring the baby out safely. It's a very labor-intensive program. And I believe that every health worker that has had EMONC training has received over 60 hours of EMONC training. But in every facility where we have actually done this EMONC training, and this is over 600 medical facilities, we have not seen a preventable death. EMONC training allows the midwife, the doctor, and even the nurse to task shift properly, to help each other better as a team, to anticipate a challenge and to deal with that challenge effectively. This is something that I would like to hope will be actually adopted across Nigeria.
I certainly hope so too. My goodness, there I was thinking in terms of cultural barriers. I thought it was all about traditional birth attendants. I had no idea what you've just highlighted. And of course, people don't give up cadavers anymore for medical students. So of course they don't have that practical training. This is a really excellent initiative. Very well done. I wanted to ask you now about your 13 years straight record of attendance of the World Economic Forum. What led you to start attending and what keeps you coming back in terms of benefits to your foundation?
I received my first invitation to a World Economic Forum event 5 years ago. And first of all, it was curiosity because, we do align with a lot of the global bodies. I do a lot of work with the United Nations. I'm a supporter of the Every Woman, Every Child effort. In fact, I brought that to Nigeria. I do a lot of work with the WHO. As far as I'm concerned, the WHO is the standard setter. So when I first started receiving invitations to Davos, first of all, there was curiosity. Everybody talks about Davos. What are they going to talk about there? But when I got there, what I realized that it was an excellent avenue, first of all, to hear everybody else's best practices, to be able to hear the method with which very successful people are pushing through innovation. And secondly, it provides a table where you can talk to every sector at the same time. A lot of the time, the private sector is left out of development unless they're coming to sponsor something. And I'm not so much about the money. I'm more about the product. For instance, I've come out of Davos this year with a new idea on how to help improve our nutrition indices. I'm now looking at food fortification. You know, every Nigerian woman cooks stew in the house every day. And I've looked at food fortification before. I had a previous partnership with Unilever Noor called Green Footsteps, where they actually fortified a stock cube with iron. And that was really because I wanted to stop anemia. Anemia is one of the predisposing factors that actually leads to maternal death in childbirth. Now we're looking at fortifying tomato paste. Everybody uses tomato paste to cook their stew. So if I could find a formula that is palatable, where we can fortify tomato paste with iron, and women anyway are cooking with tomato paste every day along with their fresh tomatoes. We already give advice that ugu is the highest iron content leaf that we have in Nigeria. I'm just looking at the kind of scale that we could have. We have a country of 200 million people, and of that 200 million people, 35% are malnourished, and that actually includes people who are obese. A lot of the time we equate size with good nutrition, and that's not really the case. You can be very, very thin and malnourished, and you can be very, very obese, and obesity is actually a medical condition. So this year, Davos was particularly interesting this year, because a lot of the time, we're walking around from meeting to meeting in the snow, and you're, listening to just men. This year we had a female quotient. So the women had got together, put together a lounge where we were meeting in between the meetings, and we were reviewing everything we had done. And Davos for me is like going to, I guess it would be like going to a summer camp when you're at school, only that it's in the winter. You begin to look at the same challenges with a different lens. You begin to think of other ways of applying a solution that will go to scale. And you meet very, very innovative potential partners. So I've got some new things that are coming out of Davos I'm very excited about. When the ink is dry on the pieces of paper, I think Nigerians will be very happy to see what we're bringing next.
Thank you so much, Mrs. Toyin Saraki. This has been a great conversation that we've had with you.